Did you know that 1 in 3 individuals will face cancer at some point in their lives? But here's what many people don't realize. Millions of cancer cases are diagnosed too late every year because the early warning signs go unnoticed. According to the American Cancer Society, detecting cancer at stage 1 can lead to survival rates exceeding 90% for several common types of cancer. However, if it's caught at stage 4, that percentage can plummet below 20%. In the next few minutes, I'll reveal 8 subtle warning signs that could genuinely save your life. These aren't the obvious symptoms everyone talks about. They're the quiet hints your body gives before the situation becomes critical. Most people completely ignore these signals, but they could be the key to catching cancer early. Now I know what you might be thinking. Every minor ache and pain feels like it could be cancer if you look it up online. That's why this video is different. We'll focus on scientifically supported warning signs, not baseless internet myths. These are the same signs that have enabled countless individuals to detect cancer early, when treatment has the highest chance of success. Stick around, because this isn't about fear-mongering. It's about equipping you with knowledge that could change everything. And since this is such a crucial topic, I've created 2 additional in-depth videos you might want to explore after this one. Now, let's jump in. One of the most overlooked early indicators of cancer is persistent bone pain. Unlike the temporary discomfort caused by exercise or minor injuries, cancer-related bone pain tends to intensify progressively and is often worse during the night. When cancer originates in or spreads to the bones, it disrupts the normal structure of bone tissue, leading to a deep, persistent ache that's difficult to ignore. Primary bone cancer, medically referred to as osteosarcoma, commonly targets the long bones in the arms and legs. Initially, the pain may be subtle, sometimes resembling a sprain or muscle soreness, but it gradually becomes more intense and unrelenting. What makes this especially concerning is its impact on daily activities, making even simple movements increasingly challenging. Some individuals describe the pain as a throbbing or aching sensation that doesn't respond to standard pain relief methods. If you experience bone pain along with swelling, increased sensitivity, or unexplained fractures, it's vital to seek medical attention without delay. Detecting bone cancer early significantly enhances treatment success, with survival rates being much higher when diagnosed in the initial stages. 2. Eye pain. Your eyes can provide valuable insights into your overall health. Among the potential indicators of cancer, ocular melanoma, though uncommon, is the most prevalent form of primary eye cancer in adults. The symptoms usually start subtly but can progress to more apparent changes that should not be ignored. When cancer develops within the eye, it may lead to distinct symptoms that differ from typical eye issues. You might notice blurred vision that doesn't improve with updated prescriptions or unusual flashes of light unrelated to migraines. One of the most alarming signs is the appearance of a dark spot on the iris that gradually increases in size or alters in color. Advanced imaging techniques, such as ophthalmoscopy, enable doctors to assess the internal structures of your eye. People with lighter-colored eyes or fair skin are at a higher risk of developing ocular melanoma. Persistent eye discomfort or unexplained vision changes should never be overlooked. Early detection is crucial in safeguarding both your vision and overall health. Routine eye exams are especially important for individuals with risk factors like extended sun exposure or a family history of eye cancer. Regarding skin changes, certain types of rashes warrant prompt medical evaluation. Leukemia, a cancer that affects blood-forming tissues, can present itself through distinctive skin symptoms that are often mistakenly dismissed. Often attributed to minor conditions, these symptoms carry a deeper significance when examined closely. A key distinction lies in the appearance and behavior of these rashes. Petechiae, tiny, round spots on the skin, are caused by a lack of platelets, a common consequence of leukemia. These spots, measuring between 1 and 2 millimeters, don't fade or blanch under pressure. Their coloration can range from red to purple or brown, often clustering in areas prone to pressure, such as the ankles or beneath tight clothing. Understanding their underlying cause is essential. Leukemia hampers your body's ability to produce sufficient healthy platelets, which are vital for preventing bleeding. In their absence, small blood vessels, known as capillaries, can leak, leading to these distinct spots. Unlike typical rashes that may itch or resolve within a few days, leukemic rashes persist and are often accompanied by additional symptoms like unexplained bruising or bleeding. Subungual melanoma, a rare form of skin cancer that develops beneath the nails, often begins as an unassuming streak. This dark line, medically referred to as melanonychia striata, runs vertically along the nail and warrants careful observation. Unlike benign nail pigmentation, cancerous streaks tend to appear suddenly and progressively worsen. The thumb and big toe are the most common sites, but it can occur on any nail. The danger lies in its resemblance to harmless conditions like nail trauma or fungal infections. Warning signs include a streak wider than 3 millimeters, multiple colors within the streak, or blurred edges. Hutchinson's sign, where the pigmentation spreads onto the surrounding skin, is a critical indicator. If you notice nail changes coupled with pain, nail splitting, or bleeding, it's imperative to seek medical evaluation promptly. Additionally, unexplained night sweats could signal an underlying health concern. Night sweats that soak your bedding and clothing may indicate more than just a warm, sleeping environment. When these episodes are frequent and unrelated to external factors or menopause, they could point to an underlying lymphoma. It's important to distinguish between regular sweating and pathological night sweats. Those associated with lymphoma often occur alongside other B symptoms, which play a critical role in diagnosing cancer. These intense, drenching sweats are usually accompanied by unexplained fevers and weight loss, forming a recognizable pattern that oncologists take seriously. The reason behind such night sweats lies in your body's immune response. As lymphoma impacts the lymphatic system, it triggers the release of inflammatory chemicals, which interfere with temperature regulation. While occasional night sweating can happen due to stress or mild illness, recurrent episodes that leave you drenched should prompt medical attention. Persistent heartburn, chronic heartburn, or gastroesophageal reflux disease, GERD, may seem like a minor inconvenience. However, if it persists despite lifestyle adjustments and medication, it could be an early warning sign of something more severe, like esophageal cancer. Persistent acid reflux that doesn't respond to conventional treatments is often one of the first signs of this cancer. The connection between chronic heartburn and cancer lies in the ongoing damage to the esophageal lining caused by stomach acid. Over time, this repeated exposure can lead to cellular changes, increasing the risk of malignancy. Recognizing the signs and seeking early evaluation is key to preventing further complications. Leading to a condition called Barrett's esophagus, this precancerous state significantly raises the likelihood of developing esophageal adenocarcinoma. Be alert for warning signs such as difficulty swallowing, food getting stuck, or unexplained weight loss alongside chronic heartburn. If you've been relying on over-the-counter heartburn medications for more than 3 weeks without relief, it's essential to consult a healthcare professional. Jaundice. Jaundice occurs when bilirubin accumulates in your body. Although it can stem from various conditions, its sudden onset in adults often signals serious concerns like pancreatic or liver cancer. In cases of pancreatic cancer, tumors may block the bile duct, preventing bilirubin from being processed and eliminated effectively. This leads to bile entering your bloodstream, resulting in yellowing of your skin and the whites of your eyes. Initially subtle, this discoloration tends to become more noticeable as the condition advances. The pancreas' deep location within the abdomen makes early detection of cancer challenging, which is why recognizing jaundice is vital, especially if it's accompanied by symptoms like upper abdominal pain, dark urine, or pale stools. Persistent or unexplained fever. A recurring fever with no clear cause is another potential warning sign that should not be ignored. Could be your body's way of signaling blood cancer. Unlike typical fevers that subside within a few days, cancer-related fevers often follow a specific pattern and may be accompanied by other systemic symptoms. Conditions like leukemia and lymphoma can cause your immune system to release chemicals called cytokines, which trigger recurring fevers. These fevers often occur without an identifiable infection and may coincide with symptoms like night sweats or unexplained weight loss. The pattern might include periodic temperature spikes, referred to as cyclic fever. If a fever persists for more than 2 weeks or keeps returning without an obvious cause, it's crucial to seek medical evaluation. Blood cancers can weaken your immune system, making infections more likely while also directly causing fever. A thorough evaluation, including blood tests, to identify abnormal cell counts and other disease markers, is essential. Early detection greatly improves the chances of successful treatment. While these symptoms don't necessarily mean you have cancer, they should never be ignored. Thank you for watching this video. If you found this information helpful, please give it a thumbs up and share it with others who could benefit. Don't forget to subscribe to our channel for more insightful health content. Remember, taking proactive steps toward your health is an investment in your future. See you in the next video.